The biggest dinner mistake. Increases risk of stroke and insomnia after 60. A study from the National Institutes of Health found that people over 60 who eat late or consume heavy meals at night have a 34% higher risk of poor sleep quality and a significantly increased chance of nighttime blood pressure spikes. Many seniors believe dinner is just another meal, but after 60, the body's ability to process food, regulate sugar, and maintain deep sleep changes drastically. One simple mistake in your evening routine could silently affect your heart, brain, and blood vessels. This video will uncover the 5 most common dinner habits that may be quietly increasing your risk of stroke, insomnia, and metabolic stress, and explain what changes you can start making tonight. Understanding these dinner-related risks could be a small shift in knowledge, but a major step toward better health in your 60s, 70s, and beyond. Eating too late in the evening. Many older adults think eating dinner later helps prevent late-night snacking or fits better with their daily routine. But after age 60, this habit can quietly disrupt the body's natural systems that control digestion, blood pressure, and sleep quality. When food is consumed close to bedtime, the digestive system remains active while the body tries to wind down. This misalignment affects the production of melatonin, the hormone that signals the brain it's time to rest. As a result, sleep onset is delayed, and deep sleep becomes fragmented. A 2021 study in the Journal of Clinical Sleep Medicine showed that seniors who ate within 2 hours of going to bed had significantly more difficulty falling asleep and were 35% more likely to experience nighttime awakenings. This link is particularly strong in individuals with prehypertension or a history of poor sleep. Late-night eating also triggers insulin release at a time when insulin sensitivity is lower. This can lead to elevated blood sugar overnight, contributing to metabolic strain and increasing the risk of type 2 diabetes, a known risk factor for stroke. For people like Harold, 68, this can be an invisible cycle. He regularly ate dinner at 9 p.m., then went to bed at 10:30. Despite getting 7 hours in bed, he often woke up groggy and needed frequent bathroom trips at night. His blood pressure remained high despite medication adjustments until his doctor recommended moving dinner earlier. In addition, lying down shortly after eating increases the likelihood of acid reflux, especially in older adults with slower gastric emptying. Nighttime reflux not only disturbs sleep, but has also been associated with elevated nighttime blood pressure, according to the American Heart Association. Experts recommend that dinner be completed at least 2.5 to 3 hours before bedtime. For most seniors, this means finishing meals no later than 6:30 or 7 p.m. This timing allows digestion to complete while the body transitions into rest mode, supporting both cardiovascular and neurological recovery during sleep. One study from Japan involving over 1,500 older adults found that those who consistently finished dinner before 7 p.m. had better sleep efficiency, lower resting heart rate, and lower nighttime blood pressure compared to late diners. Adjusting dinner timing may seem like a small shift, but it can profoundly impact how the body regulates critical systems overnight. It's not just about digestion, it's about protecting your brain, heart, and energy levels the next day. But eating late isn't the only habit silently affecting seniors after sunset. What you eat during that time matters just as much, especially when it comes to fats. Consuming heavy, high-fat meals. Many older adults believe that a hearty dinner helps keep them full through the night. But high-fat meals, especially in the evening, place an unnecessary burden on a digestive system that naturally slows down with age. As we grow older, gastric motility decreases, meaning food stays in the stomach longer. Fatty meals, particularly those rich in saturated fats like fried foods, cream-based sauces, or fatty meats, are even harder to break down, leading to prolonged digestion, bloating, and discomfort. Beyond digestion, high-fat dinners also impact cardiovascular health. Saturated fats can increase LDL cholesterol and promote inflammation in blood vessels. This is especially problematic at night, when the body is supposed to enter repair mode and reduce sympathetic nervous system activity. According to the American Journal of Hypertension, consuming fatty foods at night has been linked to higher nighttime blood pressure and a lower dip in heart rate variability, both markers associated with greater risk of stroke in individuals over 60. Additionally, heavy evening meals often lead to increased nocturnal triglyceride levels. These lipids circulate in the bloodstream and may interfere with endothelial function, the inner lining of blood vessels, raising the risk of plaque formation and poor circulation. The metabolic strain doesn't stop there. Studies show that late-day consumption of fatty foods reduces insulin sensitivity, causing blood sugar levels to remain elevated longer. This can disrupt glucose metabolism overnight and contribute to insulin resistance over time. High-fat meals are also associated with reduced production of leptin, the hormone that helps regulate appetite and energy use. When leptin signaling is impaired, the brain may misinterpret satiety cues, leading to increased nighttime hunger and poor sleep regulation. From a neurological perspective, a high-fat diet in the evening can alter the gut-brain axis. Animal studies have shown that fatty foods disrupt circadian-related signals between the digestive tract and the hypothalamus, which may negatively influence both sleep duration and quality. Experts recommend limiting saturated fats during dinner and avoiding foods that are deep-fried, creamy, or heavily processed. Instead, the evening meal should prioritize lean proteins, vegetables, and small amounts of healthy fats like olive oil or avocado. This dietary shift not only supports digestive comfort, but also aligns better with the body's natural nighttime physiology. Making lighter, low-fat choices at dinner can promote steadier blood pressure, reduce sleep disturbances, and support vascular health in aging adults. Still, fat isn't the only concern. What we drink, especially close to bedtime, can also affect how well our body rests and recovers overnight. Drinking too much fluid right before bed. Staying hydrated is essential, especially for older adults. However, consuming large amounts of fluids in the evening, particularly close to bedtime, can negatively impact both sleep quality and nighttime safety. As the body ages, kidney function gradually changes, and the ability to concentrate urine at night may decrease. This leads to more frequent nighttime urination, a condition known as nocturia, which disrupts the deep sleep cycle essential for cellular repair and cardiovascular recovery. According to a 2020 study in Sleep Health, seniors who consumed over 500 ml of fluid within 2 hours before bed were 42% more likely to experience sleep interruptions. These interruptions not only reduce sleep efficiency, but can also elevate nighttime blood pressure and heart rate. Sleep fragmentation in older adults is linked to increased risk of hypertension, weakened immune function, and even cognitive decline. Regularly waking to use the bathroom can shift the body out of restorative slow-wave sleep and into lighter stages, reducing overall sleep quality. Beyond sleep, nighttime bathroom trips also raise the risk of falls and fractures. Dim lighting, low blood pressure upon standing, and balance issues are more dangerous when compounded by sudden nighttime movement. The CDC reports that 1 in 4 older adults experiences a fall each year, and many occur at night. Certain fluids are more problematic than others. Beverages with caffeine, such as tea, coffee, or even some sodas, can act as diuretics and also stimulate the nervous system. Similarly, alcohol, while initially sedating, leads to fragmented sleep and increased urination as it is metabolized. Even seemingly healthy, drinks like soup broths or milk can contribute to overnight fluid load if consumed in excess or too late in the evening. It's not just what is consumed, but when and how much that determines its effect on rest and recovery. Experts recommend tapering fluid intake after 7 p.m. and limiting it to small sips closer to bedtime if needed. Total daily hydration should still be maintained, but distributed more evenly throughout the morning and afternoon. This strategy helps reduce nocturnal awakenings while still supporting kidney function and electrolyte balance. For those on diuretics or other medications, adjusting dosing schedules with a healthcare provider may also help minimize nighttime disruptions. Addressing fluid timing is a small but important step toward better sleep hygiene in older age. However, it's not just when or how much you drink. What you choose to skip at dinner can also play a critical role in overnight stability, and skipping too much can be just as risky. Skipping dinner or eating too little. Some older adults believe that skipping dinner or drastically reducing food intake at night can help control weight or improve sleep, but undereating in the evening may quietly disrupt metabolic balance, muscle preservation, and nighttime stability in those over 60. With aging, the body naturally loses lean muscle mass, a process called sarcopenia. Regular protein intake, spaced evenly throughout the day, plays a key role in slowing this loss. When dinner is skipped or too light, it reduces the opportunity to support overnight muscle maintenance. Additionally, going to bed on an empty stomach can lead to drops in blood glucose during the night. In seniors, these fluctuations are not always recognized immediately, but they can contribute to poor sleep, night sweats, elevated heart rate, or early morning dizziness. A study in the Journal of Gerontology found that older adults who consistently consumed less than 15% of their daily calories at dinner had higher rates of insomnia and reduced sleep efficiency. The lack of evening nutrition may signal the body that energy reserves are insufficient, triggering stress responses. For Robert, age 73, this looked like persistent fatigue and lightheadedness in the mornings. He had been avoiding dinner for months to manage his weight, thinking it would improve sleep. But instead, his sleep became shallow, and his blood pressure readings fluctuated unpredictably. The issue isn't just calories, it's also nutrients. Skipping dinner often means missing vital micronutrients like magnesium, potassium, and B vitamins, which play roles in muscle relaxation, nerve signaling, and mood stabilization, all critical for healthy sleep. Low evening food intake can also lead to increased nighttime cortisol production. Cortisol, the body's stress hormone, naturally drops in the evening to allow for restful sleep. But inadequate energy intake can signal the body to stay alert, interfering with melatonin release. Experts recommend that older adults aim for a light but balanced dinner that includes lean protein, complex carbohydrates, and a small amount of healthy fat. This combination supports stable blood sugar, satiety, and tissue recovery during sleep hours. Rather than skipping dinner altogether, it's more effective to reduce portion size while maintaining nutritional density. A small bowl of lentils with vegetables, a boiled egg with sweet potato, or a cup of oatmeal with almonds can all provide steady energy without heaviness. Dinner remains an essential anchor in the daily nutritional cycle, especially for those seeking to maintain mobility, sleep well, and avoid morning instability. But even when meals are timed and balanced, one more hidden factor can quietly undermine the whole process: the kind of carbohydrates we choose. Eating sugary or high-carb foods late. Refined carbohydrates and sugary foods may seem comforting in the evening, but for older adults, these choices can silently disrupt both blood sugar regulation and sleep architecture. The impact is often underestimated and frequently overlooked. When high glycemic foods like white rice, white bread, pastries, or sweetened snacks are consumed at dinner, they cause a rapid spike in blood glucose. This is followed by a rebound drop, known as reactive hypoglycemia, which may occur during sleep and lead to nighttime awakenings. Even in those without diabetes, this glucose roller coaster can trigger adrenaline release during the night. As blood sugar dips, the body may respond with increased heart rate, anxiety-like symptoms, or early morning wakefulness, factors that degrade overall sleep quality. A study published in the American Journal of Clinical Nutrition in 2019 found that older adults who consumed high glycemic meals within 4 hours of bedtime were 47% more likely to experience sleep disturbances compared to those eating lower GI meals. Excessive evening sugar intake can also impair melatonin production. Insulin surges can alter tryptophan transport, which affects the conversion of serotonin into melatonin, the hormone critical for initiating and maintaining sleep. In the long term, habitual intake of fast-digesting carbs at night contributes to insulin resistance, a condition in which the body becomes less effective at managing glucose. This increases the risk of metabolic syndrome, weight gain, and type 2 diabetes in seniors. Moreover, diets high in evening sugars and refined carbs have been linked to systemic inflammation, especially when combined with sedentary lifestyles. Chronic inflammation is a known factor in the progression of cardiovascular disease and cognitive decline. Simple carbohydrates also tend to crowd out more nutrient-dense options at dinner. Instead of vegetables, legumes, or whole grains, plates become dominated by white starches or dessert-like foods that offer little sustained nourishment. To reduce these risks, experts advise replacing high GI carbohydrates with complex, slower-digesting alternatives. Foods like quinoa, barley, lentils, or roasted vegetables provide steadier energy release without the hormonal swings caused by simple sugars. Even small adjustments, such as switching white rice to brown or replacing sweetened yogurt with plain, can significantly improve nighttime stability. These changes help maintain glucose balance, support melatonin rhythms, and promote more restful sleep. Sugar and starch may feel harmless at the end of the day, but they can set off a metabolic chain reaction that lasts through the night. And for seniors aiming to protect sleep, heart health, and mental clarity, that's a price too high to ignore. Evening habits may seem routine, but the wrong choices at dinner can silently disrupt sleep, blood pressure, glucose regulation, and long-term cardiovascular health, especially after age 60. Recognizing these risks is the first step toward meaningful change. This video has highlighted 5 common dinner mistakes: eating too late, consuming high-fat meals, drinking excessive fluids before bed, skipping dinner, and relying on sugary or refined carbs. Each of these can undermine overnight recovery and daytime stability. To support healthier aging, consider the following. Finish dinner 2 to 3 hours before bedtime. Keep meals light but nutritionally complete. Reduce saturated fats and added sugars, and limit fluid intake after 7 p.m. These adjustments are small, but their impact adds up over time. Health 1900s is here to provide practical, science-based guidance for smarter choices after 60. If you found this video helpful, consider subscribing for more senior-focused health content every week. Disclaimer: this video is for general informational purposes only and does not constitute medical advice. Please consult a qualified healthcare provider before making dietary or lifestyle changes.